When I was a medical student, one of my friend's mothers had breast cancer, and I saw at first hand what breast cancer was like in the 1980s. A late diagnosis, radical surgery, lymphedema, which really troubled her for the rest of her life, and ultimately she died from her disease with very few treatment options. And watching that whole family go through the experience of supporting someone through a very difficult journey made me realise when I started working in oncology, it's not just about the drugs or about the surgery, but you really have to think about the whole person and what kind of evidence we can bring to bear to make the whole of that journey better, not just one little aspect of it. So that was one of the things that encouraged me to get involved in breast cancer research when I had the opportunity. There were so many questions that needed to be answered. So here at the Mater, our two big areas of cancer research are breast cancer and melanoma. Breast cancer patients are involved in trials of different kinds of surgery, different forms of radiotherapy, drug studies, and also supportive care studies. So that means we've got to work as a team with our surgeons, our radiologists and pathologists, and also the dedicated research staff. Then they all need to communicate with the nursing staff who are actually administering medications and the pharmacy staff. So there's a lot of communication that goes on. All of those groups have to have an attitude of excellence. I think if you're offered a clinical trial as part of your care for cancer, it's really worth looking into it thoroughly, making sure that you are clear about the purpose of the trial and how it might affect you differently from a normal run through the system. People who participate in clinical trials can be sure that they're going to get excellent care, and I think that's a motivator, number one. Secondly, the extra benefit of being in a trial is that we'll learn something. Whether the trial produces a positive result and a new drug comes to market, or whether the trial doesn't show an advantage to the new treatment. Either way, we'll learn something. We need everyone in the community to be alert, to know when you get a breast cancer patient, you should always be asking the question, whether you're a GP or an oncologist or a surgeon, where's the clinical trial that might suit this particular person? I think one of the things that motivates doctors every day when they sit in the clinic is that there are so many unanswered questions. The uncertainty that we have in managing individual patients has reduced significantly because of the answers of clinical trials, but it just throws up new questions. And so every doctor will find every day they want to be involved in knowing the answers to more things. And it's clinical trials research that really allows them to participate in solving that difficulty for our individual patients. Thinking about the first breast cancer patient I knew and what her needs were, I think about what of those problems clinical trials have answered over the 25 years in between. Well, they've answered lymphedema to a large extent because we've changed the way we operate. Most people's breast cancer will be detected earlier because we've done clinical trials of breast cancer screening. Most women will receive a drug like tamoxifen or a newer one after their surgery, so we don't wait for the cancer to come back but prevent it from coming back. And if they do experience secondary breast cancer, the array of treatments open to them to keep them alive with good quality of life for much longer have all been tested in clinical trials. But not only that, support for those women's families, that's been tested in a clinical trial. What's the best way for a psychologist to help manage it? What's the best way to treat hot flushes? What's the best way to support young families? So clinical trials are not just about drugs, they are about all of the treatments we might bring to bear to help someone with a complex health problem. What I hope, of course, before I retire is that we've got even more options to offer, particularly women whose breast cancer comes back. Surely that ought to become a curable disease within the next decade.